Hello, and welcome back to Medicinal Herbs Discovered. Today, we will be discussing cinnamon. The common herbal name for cinnamon is Cinnamomum zeylanicum. Now, let's take a look at how cinnamon grows. Cinnamon is an evergreen shrub or tree. It can grow up to 50 feet tall. It has brown, orange, outer bark. Cinnamon also has leather-like leaves in an alternate rosette pattern. The fruit of the cinnamon shrub grows as a drupe with clusters of yellow-green flowers. So, what part of the cinnamon tree is medicinal? The inner bark. The inner bark of the cinnamon shrub has many constituents, including volatile oils such as hydroxycinnamaldehyde, cinnamic acid, and coumaric acid. We will discuss these main constituents in the common usage part of our discussion. First, let's take a look at the action and energetics of cinnamon. Cinnamon has a pungent, bitter, and sweet taste. Cinnamon has a hot and stimulating action. Cinnamon is considered an astringent, meaning it contracts cells and body tissues. Think of it as a puckering motion of the tissues. In Ayurvedic medicine, it will increase pitta. Now, let's look at some of the common uses for cinnamon. Cinnamon is a digestive stimulant. Cinnamon achieves this by using its constituent, cinnamic acid. Cinnamic acid binds to the protein pathways to inhibit liver enzymes. The inhibition of these enzymes decreases the blood fat levels and fatty tissue deposition in the body. Hydroxycinnamaldehyde, another constituent, is also used to increase glucose uptake in muscle and fat tissues. It does this while at the same time decreasing starch digestion. So, who does this help? This will help individuals trying to lose weight or trying to decrease fat mass or body mass index, also called BMI. A second common use for cinnamon is its powerful anti-inflammatory effects. Cinnamon's constituent, coumaric acid, decreases the expression of inflammatory mediators. These mediators are responsible for the inflammation of tissues, especially those in the GI tract. Cinnamon, in effect, turns down the inflammation in these tissues. This benefit of cinnamon greatly helps those experiencing flatulence and bloating in the GI tract. Cinnamon also helps to reduce blood glucose. Cinnamic acid prevents beta cell destruction in the pancreas. By retaining these beta cells, the pancreas can secrete more insulin. Insulin controls the level of sugar in the blood. In this way, cinnamon could help a type 2 diabetic or someone with prediabetes to maintain appropriate blood sugar levels. Studies have also shown that cinnamon can help women experiencing insulin resistance with polycystic ovarian syndrome. So, where can we find cinnamon? Cinnamon grows in warm and humid climates and throughout grow zones 10 through 12. Unfortunately, the first harvest of the cinnamon bark won't be possible until 2 to 3 years after planting. You can then harvest cinnamon every 2 years. Harvesting cinnamon entails cutting either a branch from the tree or shrub or the whole plant. If the whole plant is cut down, the roots will send up new shoots to take its place. To harvest cinnamon, you must scrape the outer layer until you see the yellowish-orange layer. This is the layer that we harvest. To preserve cinnamon, lay out pieces to dry. As the cinnamon bark dries, it curls into what we all know to be cinnamon sticks. Cinnamon has very few side effects. These include skin irritation and heartburn to those that are sensitive. There are no medical contraindications for cinnamon. However, cinnamon is incompatible with certain medications. Patients should not use medicinal cinnamon with blood thinners. Since the fumaric acid in cinnamon can also thin the blood, this can lead to undesirable bleeding risks. Medicinal cinnamon can also affect seizure medications. Because cinnamic acid inhibits liver enzymes, seizure medication levels can increase into toxic range. This interaction is also possible with statin cholesterol drugs. Medicinal cinnamon may also boost these statin levels from therapeutic to toxic. These interactions can cause hepatitis if not monitored appropriately. The most common medicinal preparation for cinnamon is cinnamon tea. Medicinal tea is made by steeping 0.5 to 4 grams of cinnamon bark in 8 ounces of water. We can drink cinnamon tea daily for its beneficial effects. Cinnamon tinctures can also be made using dried cinnamon sticks. We can tincture the cinnamon in alcohol. Once tinctured, patients can take 2 to 4 milliliters by mouth daily. So, who is cinnamon for? Adults? Yes. During pregnancy? Yes. During breastfeeding and lactation? Yes. For kids? Yes. Remember, always ask your doctor before starting any new medication or supplement. Thanks for watching. Please consider subscribing to Medicinal Herbs Discovered. We post new top 5 videos every week, as well as a new herb of the week every Friday afternoon. You may enjoy these playlists as well, including other medicinal herbs and condition-specific compilations with their top 5 herbs. Thanks, and happy watching!